President Biden says the COVID-19 pandemic is over. And as we head into the colder months, cases and deaths have been steadily declining nationwide.
Still, 500 people are losing their lives daily to this virus, according to the current 7-day average. We want to bring in MSNBC medical contributor Dr. Uché Blackstock. Dr. Blackstock, the president made these remarks. I want you to listen to them. He was talking in an interview with 60 Minutes, and then we're going to discuss his comments on the other side.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
Okay, you heard him say it right there. The pandemic is over, right? It is worth noting that the World Health Organization, I believe just last week, said the end is near for this pandemic, right? Global deaths are decreasing. But do you agree with what President Biden said, that the pandemic is over? And also, what is the scientific definition for when you say a pandemic is over?
Right. So, Vicki, thank you so much for having me. So I think many of us in medicine and public health probably did a double take after hearing President Biden saying that, just because, as you mentioned, 500 people are still dying a day. By definition, a pandemic is multiple outbreaks in many different countries or in geographical areas. We technically still are having that. And so what we do know is that there is no specific definition of how to get out of a pandemic, like what a pandemic is not. But currently, we still have 500 people dying a day. We still have pretty high infection rates, about tens of thousands of people being infected. And so while people are getting vaccinated and boosted, we really need to see a sustained decline in cases, hospitalizations, and deaths. And I can't say that we are there yet. I think that calling the pandemic is over was a little bit premature.
Okay.
Well, we know the pandemic isn't over for certain groups of people, like people who are immunocompromised. What would it take for them to sort of get back to a normal pre-pandemic life?
Oh, I think that's such a great question. I think that we've put a lot of the onus on people who are immunocompromised to protect themselves. I would say being able to go out in public without having to wear a mask or being concerned about getting infected. And a lot of our immunocompromised individuals are not there yet. Many of them are still at home because they're scared to go outside because transmission levels are still quite high. I would expect to see lower transmission levels than we're seeing now. Now we still have them, they're substantial to high, and that's just too high for immunocompromised people to be outside safely.
Well, speaking of high infection rates that are ongoing, we are just a couple of days from the official start of fall. School is back in session. I can tell you from personal experience, kids, teachers, everyone's still getting COVID infections, as we enter the new school year. So what are you expecting as we go into fall, winter, people are in close quarters, and what's the best time to get a booster?
Right. I think what we'll see is what we've seen the last 2 winters, and that there's going to be a bump in cases, right? People are spending more times indoor. The cold weather is an environment where the virus actually thrives. So the cases are going to go up. We have to really encourage people to get vaccinated and boosted. That is crucial. We're seeing from the data that being boosted, it really saves lives, it decreases hospitalizations as well as deaths. And so we need that public messaging out there for people to get boosted. Still, 1/3 of people have only been boosted who are qualified, eligible to be boosted.
Are those boosters widely available for people right now?
Yes, they are available. So those Omicron-specific boosters are available. People should really be going to their closest either public health departments or pharmacies to get those boosters because they are effective. And, people ask, when should they get them? I would say you get them as soon as possible, okay? Because we know that they're most effective in the first few months against transmission. And so heading into the cold weather, getting them now would probably be the best decision.
I guess just big picture, when we go back 2 years ago, or almost 3 at this point, when the pandemic began, there was so much talk about herd immunity. One, have we reached herd immunity? And two, while I hear, you and the medical community being very cautious about COVID, to the president's sort of point, is it time that we treat COVID differently? Like, is it different at this point because it's not as deadly, given where the science and the medicine is? Is it different from a virus, for example?
Right. So I think the key is we don't know what's around the corner. So we don't know what the next variant will bring. So yes, while we have Omicron now that is, produces milder disease, and we have a great a booster against it, we don't know what's to come. So I think that's why I think many of us are still very cautious. And heading into the winter, I would say we just need to be, thinking about getting vaccinated, getting boosted, being concerned about being in indoor spaces as well.
All right. Dr. Uché Blackstock, thank you so much for your time and your expertise. We really appreciate it.
Thank you, Dr. Blackstock.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.